So this gentleman was outside using a chainsaw cutting up some wood when all of a sudden he felt a sharp pain in his eye. So you can see that there's a large nail there and we're about to remove it. And here it goes. How will I close this very large wound left by the nail that we've removed? First, I'm going to remove the vitreous that's being expressed from the wound. And as you can see, there's some eyelashes here as well that we need to get out of the surgical field. Also using a weck here to get this last eyelash. And there's still quite a bit of vitreous jelly there, so I'm trying to just remove it without creating a lot of traction. Now I'm going to start closing this wound so that we can eventually do the lensectomy. And we'll speed it up here a little bit for the closure. You can see also that the nail has left behind some rust into the cornea, but at this point we'll just close the wound and worry about that aspect of it. At this point I have no idea how many sutures are going to be required to close the wound, but at first I'm just trying to get this to be relatively watertight. But as you can see, when I put in the trocar here, still quite a bit of vitreous is being expressed. So this wound needs some more closure. Now we're going to start with the vitrectomy aspect of the procedure, and I'm going to do a lensectomy. And this is a young patient, so I'm just going to use the vitrector to remove all of the lens material here. And the nail is definitely penetrated through the lens. That's how we're having the expression of the vitreous all the way through the lens. Here we can see that once we get a relatively decent view with the biome, that we have a good view to the retina, and the retina itself is intact. So the nail itself amazingly just went through the lens into the vitreous without hitting the retina or anything else. And you can see we have a really clear view here. So my goal here is just to remove any as much vitreous as possible without creating more damage. Plus I want to check the peripheral retina to make sure there's no additional breaks or tears in the retina. So here I'm going to depress the peripheral retina to make sure there's no breaks or tears. So looking at the retina for 360 degrees, we can see thankfully that there are no additional peripheral retinal pathology. I'm going to continue to close this wound a little bit more to see if we can make sure that it's watertight here. And obviously we're creating a whole bunch of astigmatism. So prior to surgery, this patient's vision was light perception, as you would expect. You can see still it's not quite closed, but now as we're closing up the rest of the eye, we can see that check the pressure, and it was in fact holding pressure in normal palpation. Patient's vision on post-operative day 1 actually improved up to count fingers, and in about 1 month it was seeing 2200 aphakic. So this patient's going to require a corneal transplant and a secondary intraocular lens transplant in the future. Thank you very much.